Okay. Now, can HPV infection be prevented?
Yes.
Mm-hmm.
So HPV infection can be prevented, and that is why we're providing this HPV vaccination. So it is the most effective way to prevent the infection of human papillomavirus, which causes cervical cancer. So for best results, the HPV vaccine is given before an individual becomes sexually active, like I mentioned. So that is the best way to prevent HPV infection.
Is it going to be administered for free?
Yes,
Or
it's
do we have to
free
pay
of
to tell you
charge.
something?
It's very free.
I think it's important that people know that it's free so that
Yeah.
they avoid being
No
exposed.
charge is expected. It's free of charge. That
Okay.
should be stressed.
So take your little girls, take your young girls for the HPV vaccination during this campaign period that goes up to 30th September, which is Saturday. Now, isn't the period too short? Because I was looking
So
at.
it's already begun. It began on Monday, 25th,
Mhm.
right up to Saturday. So,
Wow.
like I mentioned, they're out there in schools, and I'm sure there are girls that have already received this vaccine.
So this is nationwide.
Yes, this
Because
is
I
nationwide.
saw an article that was talking about that the target is about 1.9 million girls.
Sure.
Wow, that's a good number. This is the A Side Breakfast Show. For those that are just joining us, you are listening to Esnet Lungu, and I am here with Misozi Zulu, who is Health Systems Strengthening Nurse at Chipata First Level Hospital, and we are discussing the human papilloma virus. That's the vaccination campaign that started on Monday and going up to Saturday, the 30th of September. Now, you said that the HPV in most women is what develops into cervical cancer. I always get the pronunciation. Some people say cervical cancer because the cervix, and then some people say cervical cancer.
I think it's just different scholars. It's one
True.
and the same schools. Well, it's one and the same thing. So
Yeah.
different scholars will pronounce things differently. So yeah, cervical cancer, cervical cancer. We're all talking about the cervix.
Yeah.
So a cancer of the cervix.
Right.
Sure.
So now, tell us what this is. I think people that call it cervical cancer should call it the cervix because that's the only way to make
one would,
sense.
one would assume so, but that is that is not how it is.
Yeah, but you
Yeah.
tell us what cervical cancer is.
Yeah. All right. So cervical cancer, this is a very serious disease of the cervix. So when one asks what is a cervix, so the cervix is like the opening of the womb. So it's like the mouth of the womb.
Mm.
So yeah, so it's a part of the female reproductive organ, which starts as an uncontrollable growth. So, like many other cancers, it usually develops the same cells, but they outgrow themselves to abnormal cells, which then spread to the entire cervix, the womb, and entire body. And then eventually, this can actually lead to death. So, cervical cancer is caused by this HPV infection. And this cervical cancer is the most common of all cancers in Zambia. And it's actually the leading cause of death due to cancers. So you can just understand the magnitude of cervical cancer and what impact that this can cause to the country. Yeah.
Is the HPV the only thing that can cause cervical cancer?
Yeah. It's the only thing that can cause, scientifically proven, that can cause cervical cancer.
Okay.
Yeah,
Now,
but there are other predisposing factors that can lead to the development of cervical cancer. So when I say predisposing factors, I mean things that can enhance one to have this infection. So when after sexual intercourse, and probably this woman or this young girl is probably douching or putting other material stuff or introducing other material stuff to the cervix, this can actually predispose this infection, this HPV infection, right through to the cervix, because there could be inflammation, or rather there could be injury to the cervix, and this may lead to abnormal growths and later cervical cancer.
what are the symptoms of cervical cancer? First of all, would you have symptoms of the virus that you have it?
Okay, you may not have symptoms of the virus, but you may have symptoms of having an infection of the cervix. So not per se cervical cancer. So you may have symptoms of cervical cancer, you may have symptoms of having an infection, but usually it's if you have HPV, you may not even know that you have this HPV. Yeah.
So
So some of the symptoms that one may portray with lower abdominal pains in females. Yeah, that's females. So they have lower abdominal pains. They have increased cervical discharge. Yeah, and basically they're actually vague symptoms, backache. So some of those are some of the symptoms that one may relate with. However, it is quite symptomless in most times. Yeah.
people want to be safe. For example, I just have this phobia that maybe because you, like you said, you can't tell that you have the virus.
Yes,
So
unless you go for a screen. And that is why we are actually having this campaign so that we prevent the girls from having HPV. So we're giving them HPV vaccine to protect them from cervical cancer. So if one has it, you may actually not know unless you go for a screen.
for the
So
virus.
yes, unless you go for a screen to check if you have any precancerous lesions. So for the age group that is 9 to 14, or those who are already sexually active or above age, have probably symptoms or no symptoms, they can easily access cervical cancer screening services from health facilities free of charge. So that is, they just simply go to the facility, they get screened so that they are able to see whether they have any precancerous lesions or not, and then be able to receive treatment. Yeah.
Okay. So it's only through screening. There's nothing like you might not even suspect it.
Yeah.
Suspect it, but as long as it's sexually active, you can go for screening.
Exactly.
So at the same time, so you can do cervical cancer screening as well, too, right?
Yes, you can do cervical cancer screening.
Okay.
Yeah.
Now, why is it important for girls to be? We have you mentioned this for girls to be vaccinated against HPV, but maybe you can also just emphasize on other reasons why it could be important.
Yeah. So, HPV is extremely common virus that causes cervical cancer. And one of the top killers of women in the world. So not only in Zambia, but in the world. So, however, when the vaccine is given to the girls at this age and before they are exposed to the virus, it can actually protect them from the most harmful types of HPV. So it's better to be prevented than to actually go through the cervical cancer stages and whatnot. So it's actually very important that girls 9 to 14 get their vaccine to protect them actually from having this very deadly HPV virus infection. Yeah.
Now, speaking of vaccinations, there are a lot of myths and misconceptions are like around everywhere about vaccinations. So, first of all, people would wonder about the safety. And as you answer about whether they're safe or not, I mean, because obviously you can't give people things that are not safe. But I would like, first of all, to find out before we go into that, what
Mhm.
are some of the craziest myths and misconceptions you've heard about vaccinations?
Well, there's so many myths and misconceptions about vaccinations, such as depopulating the world. There are so many things like one will not have children after this vaccination and whatnot. So the myths are quite diverse. However, people need to understand that these are things that we're actually seeing now. There are women out there who have these cancers, and their testimonies that people can tell you to say, I've gone for a screen, I have had lesions. I actually was symptomless, but they found these cervical cancer lesions. They showed me and they told me I had to actually be treated for it. So when one listens to those true stories, to those people who actually had undergone some treatment of some sort, then they will know that this is actually very important that they receive vaccinations. So HPV vaccination is actually very, very safe. And it's like I mentioned earlier, it's the safest way to protect the girls from having HPV infection. Yeah.
So, what is the guarantee? How do you know that
So
these are
these
safe?
these vaccines have been well tested and they've been found to be very safe and effective. So there've been millions of doses of HPV vaccinations that have been administered worldwide. So this HPV campaign, it's happened in other countries before. It's not only in Zambia, and other developed countries have been receiving these doses and been protecting their masses from having this serious disease. So in Zambia, this vaccine has been safely administered many times before. So remember, this is not the first time that we're actually administering this HPV. It's happened before, and so it's actually very safe. And then we have vaccine experts, so both from World Health Organization, from Zambia, that have actually recommended the use of HPV vaccine. And so it is important that all the listeners out there, parents, actually allow their girls to actually be vaccinated, because this is a lifelong protection from HPV infection, cervical cancer.
Are there any side effects that come with the vaccine, with the HPV vaccine?
Sure. So, like many other um, vaccines or anything that is getting to the body, especially with the needle, you expect minor adverse events that are common to vaccines, which may be experienced, such as there'll be local pain because obviously the needle went through the skin. There could be some slight swelling or redness at the site of injection. Others may present with some slight fever, some nausea here and there, headache. Yeah, so these adverse events, they normally resolve quickly and on their own. And if any adverse events like persist, everyone is actually asked to seek medical attention. However, these are quite minimal.
Okay.
Yeah.
But let's talk about now some allergies. So some people, have you ever had instances where people are allergic to any vaccines?
So allergic to vaccines. So vaccines are usually tested. Yes, they are tested, and so you find that the most people are actually it's actually safe for everyone. So if anyone was to be allergic, they could actually, the allergy that you're talking about in this, I assume, is the side effects or the adverse events.
No, no,
Yeah.
maybe like there could be allergic reactions. Some people could maybe develop allergic reactions to certain
Okay,
things that's
so
away from the side effects.
okay, so that has not been recorded, and we're not really aware of that allergic reactions. Yeah. But like I mentioned, there could be some local pain, some swelling here and there, some nausea. Yeah,
All right.
sure.
This is the A side breakfast. Show time is 08:50, and we are discussing the human papilloma virus vaccine for girls aged 9 to 14 years old under the campaign by the Ministry of Health that's running from it started on Monday and going up to Saturday, the 30th of September. With me in studio is Misozi Zulu, who is Health Systems Strengthening Nurse at Chipata First Level Hospital, and my name is Esnat Lungu. Now, this is something that I think it's quite common, though not really like I think it's quite common, where you might, like you've mentioned, the side effects. Maybe some people just feel, I don't want any discomfort right now. I don't want to start feeling like this, and so maybe they're discouraged from going to get their vaccine.
So I think it's better to feel a little discomfort for a day than to suffer from a cancer for lifelong. So I think you would agree with me that it's better you get the benefits than the risks. So definitely others would be discouraged. Needle, I'm kind of frightened. I don't like needles. I don't like pricks. But that's just only for a while. But it gives you lifelong protection, and that is what is more important, and that is what the Ministry of Health is actually campaigning for.
So it's a once-off vaccine, or once
Yes,
a young
this
girl.
one is a once-off vaccine, and it's a cohort. Yeah, so it's a multi-age cohort, 9 to 14 years. Sure.
You mentioned earlier that, for example, people that might have, like young girls that have HIV, have to go maybe for a second or third dose. Are there any other people with maybe underlying conditions that might, or how are you treating basically other people with other underlying conditions that maybe might, because obviously you're doing that because it might not be effective the first time, so it needs like a little more amount.
Yeah.
So are there other people with underlying conditions that maybe need a special kind of dosage for
Of
them
course,
to
there
get the
could
vaccine?
be other people with underlying conditions that have probably reduced body immunity, but one of them that is more pronounced is the HIV infection. As you know, HIV infection is just basically deters one's full body immunity. And so to actually get rid of that compromise, we need to actually have them to give them these 3 doses so that they can have the maximum protection from HPV infection and later cervical cancer.
Could you give other examples? Because I'm thinking there could be a mother that's thinking my child is taking way too many medicines, and maybe that's going to be too much of a burden, or maybe this is going to contribute to making her condition worse, especially considering the side effects that you mentioned.
Okay, so for the sick, like for the critically sick children, those probably who have other diseases that are kind of like organ failure and whatnot, those ones can be probably exceptioned, and they need to actually visit the hospital so that they can be actually given that advice. So for body immunity, like those who have compromised immunity, the main one that could be outstanding is HIV infection. For those that have body organ failures, there are those who are actually hospitalized and probably could be exempted. But for others who have probably flu, malaria, and whatnot, those actually cannot be exempted. Those are conditions that can actually go with the vaccine, and they can actually receive the HPV vaccine.
Okay.
Yeah.
All right. And your closing remarks as we end the interview.
Sure, thank you. So I just want to encourage all the parents, all the girls aged 9 to 14 to have their vaccine, because this is a lifelong prevention from cervical cancer. And like I mentioned, cervical cancer is one of the leading cause of deaths due to cancers in Zambia. And so we want to protect all the girls aged 9 to 14. So if there's anyone there listening who's not had their vaccine, 9 to 14 years, please visit the hospital or the community where they can actually where you can actually access this. And I know most of us are accessing it in schools. So go girls, let's get HPV vaccination.
And
Thank
get
you.
healthy. Thank you so much, Misozi, for coming through.
Thank you so much, Esnet, for having me.
All right. This has been the dessert segment for today. My name is Esnat Lungo, and I have been hosting Misozi Zulu, who is Health Systems Strengthening Nurse at Chipata First Level Hospital. And we have been discussing the human papillomavirus HPV multi-age cohort vaccination campaign that is meant to protect girls aged 9 and 14 years old from developing cervical cancer in later years. And this campaign started on Monday and going up to Saturday, the 30th of September 2023. It is a countrywide campaign. So if you have young girls aged between 9 to 14 years old, please go and get them vaccinated. That's it for our dessert segment. Lucy and I will be up to close in a short while.